Hello, my name is Kevin. I'm a student at Nightingale College, and today I will be performing tracheostomy care. To begin with, I'm going to perform hand hygiene, gather my supplies, knock on the patient's door, enter the room, introduce myself, explain the procedure I'm going to be performing. I'm then going to perform hand hygiene, position my client into a high Fowler's position, and suction if necessary. Okay? And then, since this is a sterile procedure, I'm going to open my tray away from me. Same thing, I'm going to remove my gloves. And then with this, I want to maintain sterility by only maintaining the 1-inch border. So I'm going to open it. And the shiny side is going to be on the surface. Okay, I'm going to dump my contents onto the sheet. And then with this tray, I'm going to have a hydrogen saline mixture, and then in the tube front, it's going to be saline only. Okay, I'm going to perform hand hygiene and put on clean gloves. Okay, I'm going to remove the cannula, and it's going to go into the hydrogen saline mixture. I'm going to remove the gauze as well. When I'm doing it, I'm going to make sure to stabilize the trach. Okay, this goes in. Discard. I'm then going to remove the clean gloves. Perform hand hygiene, and then I'm going to put on my sterile gloves. So same concept, maintaining that sterility by only touching the 1-inch. Okay, so with my non-dominant hand, I'm going to grab it and away from the sterile field. Okay, and then I'm going to grab the other glove. Okay, away from the sterile field, thumb out. Okay, now I'm going to discard this. Okay, so now with my sterile hand, I'm going to grab the brush, and then with my dirty sterile hand, I'm going to hold the cannula, and then I'm going to clean it. Okay, make sure that it's cleaned, discard the brush, and then I'm going to place this in the saline mixture only. Okay, now I am going to grab my cotton applicators, and I'm going to place it in the saline mixture only. that's in, I am going to dip it in the saline mixture, and I'm going to clean, discard, clean, discard, clean, discard, clean, discard. Okay, now the inner cannula will be placed back in, making sure that the curvature is the same as I took it out. Okay. Ooh. After I cleaned, I will use my gauze, and I'm actually going to pat dry. So pat dry, discard, then I would reinsert the cannula. So the cannula is back in, and then I'm going to get my split gauze. Some split gauze. Okay, we'll just say this was clean, but the split gauze. Okay, and I am now going to remove the ties. So when I'm removing the ties, I want to make sure that I secure the cannula. Okay, now I'm going to apply the new ties. And a little bit to the other side. And then I'm going to secure the ties on both sides. And then I want to place one finger underneath to make sure that it's not too tight, because that could be a choking hazard. Once that's done, I'm going to lower my patient into a safe position. I'm going to make sure a call light is within their reach. I'm going to remove my gloves. And then discard my contents. I will perform hand hygiene, exit the client's room, and document that the procedure is complete.